Hey guys, it's me. I just wanted to give you an update about what's going on recently. First of all, first things first, baby is good, baby is healthy. I am almost 14 weeks and I heard the heartbeat. I got like another ultrasound. Everything's healthy and everything's developing fine. So that's good. And me and my boyfriend are good. We are together and working things out. I'm finishing my schoolwork. I'm doing really good with that. So everything's going really good. In other news, if you guys watched my last video, that I posted, with the note cards, like my experience, strength, and hope, you can kind of gather that I've gone through a lot and I have a lot of, mental health problems. A couple weeks ago, I never noticed this. Sorry, someone texted me. I noticed that I had these symptoms, but I was never formally diagnosed until like 2.5, 3 weeks ago. That's my dog, by the way. Say hi, Snoopy. Say hi. Yes. Okay. A couple weeks ago, I was formally diagnosed with multiple personality disorder, and they kind of call it now dissociative identity disorder. On top of already being bipolar and clinically depressed. Yay. So basically, I'll read you a little bit like the medical and like psychological like definition of it, and then I'll kind of tell you like how I feel, just so you get a better idea of what it is. Dissociative identity disorder, previously known as multiple personality disorder, is an effect of severe trauma during early childhood, usually extreme or repetitive physical, sexual, or emotional abuse. And I was bullied and harassed my entire childhood. And my parents got divorced, and I started there's just a lot that went on in my life, like severe emotional, like distraught, like awful. So I think that's where it all came from. That would make sense. Most people experience like dissociation like mildly. My dog's getting unhappy. He's bored. Like most people, like they'll daydream or they'll like zone out. Kids call it, but like somebody with DID like me, like completely like dissociates themselves from like anything. Like they will literally like lose their consciousness. I'm not talking like fall over and like pass out like they're unconscious. Like they mentally aren't there. And I've always noticed that I've done that, and now it just all makes sense. Like I will literally, like, if something is too painful or something is just like I can't deal with it, like emotionally I don't have the capacity to like deal with it, like without even thinking, like just subconsciously and like unintentionally, like I will just remove myself. Sorry, seeing what time it is. I will just remove myself like from the situation. Like I will dissociate myself so much that I like almost slip away from like my conscious self. It's almost like being numb, kind of. Like I am not even really there. I'm not listening. If someone were talking to me in my dissociative state, like I would just be like. And I remember one time it happened, it stuck with, it made me think, like I really remember this moment. I was out in the middle of the night, this was like over the summer, maybe before the summer, like April, I don't know, it was a while ago, and I was out getting really messed up. I was using drugs and alcohol, and that next morning, like I hadn't gone to sleep that night. I was at a party at someone's house, and like I was really gone, like I was obliviated. And the next morning, like 5 or 6 in the morning, we were all outside on the deck and no one had really slept at all, and I was zoning. Like I was gone for like 15 minutes, 20 minutes, like gone. I was sitting on my boyfriend's lap and I was fine when I got there, and then all of a sudden I was just like I was gone. Like nobody, my boyfriend, I remember hearing everybody, like, talking to me. But I was just gone. Like, I wouldn't answer. I would, like, I was barely blinking. Like, I was just, like, slumped over. Like, it was, and then all of a sudden I was like, what? Like, I was there again. It was so weird. And, like, I remember that. So, yeah, and it also, so, this is, like, my life story. I'll just read it to you. I took a picture of it on my computer because it's just, like, it's just so me. It makes sense. It says people with DID may have trouble keeping a job, maintaining relationships, and are at risk for engaging in drug and alcohol abuse, as well as hurting themselves and others. I am a recovering drug addict and alcoholic. I am a recovering cutter. I walked out of 2 jobs, and I got fired from 1. These are all in really short times. Like a month at each job, maybe, if that. And I ruin a lot of relationships. So yeah, it really sucks. I'm pregnant as well, so, like, on top of everything I have going on, like, all the mental health issues and, like, disorders I have, like, just adding this just is too much. So, it just sucks. Like, I really have to be careful now. I mean, I'm glad I'm, like, aware of it now, but that just makes me think, like, it just sucks. I don't want to go through, like, the rest of my life like this, you know? So I'm going to try and get on some medicine. I know there's some medicines you can take while you're pregnant. And it's, like, one of the treatments is psychotherapy, which is kind of what I'm doing, like, cognitive therapy. So I'm doing that Thursday, and, like, I'll go weekly, or however many times I need to. And, yeah, because I just want to cope with this. I don't want this to hold me back, and I don't want, one thing I always learned is, like, you shouldn't let, like, your disorder or whatever, like, define who you are. Like, I'm not a cutter. I'm not Christina the alcoholic. Like, I'm not Christina, you know, like, I'm not bipolar. Like, I suffer from a disability called bipolar and multiple personality disorder, but I am not MPD. You know what I mean? Like, that's not me. That's not myself. I don't define myself by that stuff. I'm Christina, and I am how I am. So I just want to let you guys know what's going on. Around my 20-week thing, I'm going to put a pregnancy update. With my ultrasound pictures, and I'll tell you guys the sex. Yay! I'm finding out. Everybody thinks it's going to be a girl, but I really hope it's a boy. But I don't care as long as it's healthy, so. Okay, well, subscribe. And, yeah. Bye, guys.